Chapter 11. Chapter 11 is a hefty chapter. They cover 3 different things that are covered in about 4 different chapters in the other anatomy and physiology book that I use, which means they, for one thing, give it less detail, less in depth, but they're also covering the same breadth of material.
Wendy or Kira Smith, if you're still in the building, could you please come to the office?
And the topic of Chapter 11 is the nervous system, specifically the different divisions of the nervous system. So we're going to look at the brain, the spinal cord, the peripheral nervous system, and the autonomic nervous system. Starting with the central nervous system. So the central nervous system is the brain and the spinal cord, the 2 major organs of that system. The brain is the largest, most complex part of the nervous system. We really don't understand completely how it works. But we do know that the brain is important for controlling sensation, perception, movement, and thinking. It's got some different regions. There is a cerebrum, which is divided into 2 hemispheres, a diencephalon, a brainstem, and cerebellum. And actually, there are some subparts to each of those. So the brainstem connects the brain to the spinal cord. Both the brain and the spinal cord connect to the peripheral nervous system, which we call PNS, by means of peripheral nerves, either spinal nerves or cranial nerves. And there are some protective structures around the brain and spinal cord that include the meninges that are between the bone and the soft tissue of the nervous system. So we'll start with those protective layers. They are called the meninges. There are 3 of them. The outermost layer is a very tough layer. It's called the dura mater, which literally means tough mother. Its dense connective tissue fills the dural sinuses and into the epidural space. Below that is the middle layer called the arachnoid mater, because it looks like a web anatomically, and that is literally translates as spider mother. This is also where we have the subarachnoid space that contains cerebral spinal fluid we'll talk about in a few moments. And the innermost layer, which is attached to the surface of the brain and the spinal cord, really intimately in contact with it, it's called the pia mater, which translates as the gentle mother. That has blood and vessels and nerves going into it and around the brain. It's where you get nourishment for the central nervous system. And they are shown here, and I suggest you go in your book and take a closer look at each of those. There are also ventricles, and in those ventricles, and along with the canals that connect them, there is cerebral spinal fluid. The cerebral spinal fluid is produced in those 4 ventricles, and those 4 ventricles are interconnected cavities within the cerebral hemisphere and the brainstem. The ventricles are continuous with a canal that runs the length of the spinal cord, called the central canal, and they are filled with cerebral spinal fluid. Cerebral spinal fluid is similar to plasma, but the metabolic contents of it are much more tightly controlled. Those ventricles, those spaces in your brain, there are 2 lateral ventricles called the first and second ventricles. There's a 3rd ventricle and then the 4th ventricle. There are interventricular foramen as well as a cerebral aqueduct. And they are shown here in blue. Cerebral spinal fluid is produced by the choroid plexus, which are a special group of capillaries in the pia mater that are covered by epidermal cells. They selectively transfer substances from the blood, meaning the plasma, to form cerebral spinal fluid. Those substances are nutritive and protective. They supply nutrients.
Mr. McLean, could you come to the office, please, Mr. McLean?
They help maintain a stable ionic concentrations within the central nervous system. They circulate in the ventricles. It circulates in the ventricles, the central part of the spinal cord, the central canal, and the subarachnoid space. After exchanging substances, that cerebral spinal fluid is absorbed by the arachnoid granulations, and the volume of cerebral spinal fluid at any given moment is approximately 140 milliliters. And here are the pathways they circulate. Spinal fluid pressure is important clinically. We need a continuous secretion and reabsorption that keeps the pressure in the ventricles relatively constant. If you interfere with that circulation, which could be an infection, a tumor, or a clot, you can increase the intracranial pressure within the ventricles. That pushes on the brain. That could lead to the collapse of blood vessels, injury of brain tissue, which gets compressed against the skull. And it would require a spinal tap or lumbar puncture to measure that cerebral spinal fluid pressure. We can drain it with a tube into the subarachnoid space, and it's not a common thing that happens to infants, but infants do have a little bit of an advantage with the fontanelles. There's room for that fluid to expand, so that would be treated with a shunt. But their brain would not be compressed against the skull the way it would be in an adult. Traumatic brain injuries are the result of some force, usually a fall, an attack, an accident, or sports injury. Some of them would include concussions, which would be considered a mild traumatic brain injury. And if that's a one-time injury, has no long-lasting symptoms, but we know more and more that concussions are additive, that more than one, and we can have some real serious injuries. Chronic traumatic encephalopathy is a sports-related. It comes from repetitive traumatic brain injuries. Lots of small injuries over a great deal of time have long-lasting effects, particularly on memory and behavior, some of the most complex things our brain does for us. And also blast-related injuries we need to talk about in these days of soldiers overseas, or explosions that happen anywhere that can lead to severe TBI and loss of cognition years after the injury. Okay, we'll stop there.